Hello, we are in Macau for the International Scientific Meeting in 2011. I'm Gianluigi Pilu, and I'm sitting close to Tabor. And Anne has been responsible for an important program for risk assessment of trisomy 21 nationally in Denmark. And her group has published a very interesting study recently that has to do with a rather important problem. We know that nuclear translucency and biochemistry are affected not only by trisomy 21 but also by other types of aneuploidies. And until now we didn't know clearly what to do when there was an increase at the risk of trisomy 13 and 18. But the data that have been published by Anne and her group recently have shed some light on that. Can you elaborate on this, Anne?
Yes. Before we introduced screening for trisomy 21, we had about 15 to 20 cases of trisomy 13 and 18 born a year in Denmark. Now we're down to having 1 or 2 cases detected after 22 weeks because we screen for trisomy 13 and 18 at the time of the first trimester scan as well. And we have seen nearly a very, very small increase in the screen positive rate as we use the algorithm for trisomy 13-18 screening, which is a cutoff of 1 in 150, not 1 in 300 as for Down syndrome. So 80% are detected already at 13, 14 weeks, which is a great advantage because you can have a very early termination of pregnancy in these pregnancies, which will never lead to the birth of a live normal child.
Well, this was certainly a major step forward for screening programs, and I would recommend any of you to look for the article that is already available in our journal. Thank you very much, Anne.
Thank you.